athletics is good. Participation, first of all, it's the physical activity that's important, but also it's the involvement, it's the participation, it's the teamwork, it's the thing that kids learn by participating with their peers. The obesity epidemic is rampant. It's a major U.S. Health concern. We have to look to regular exercise for all of us to maintain appropriate weight. Children need at least 60 minutes of daily exercise, moderate to vigorous per day, and even as much as 90 minutes. They get that through sports and practice. Organized sports are good and healthy, as we talked about, and it promotes that transition to lifelong active behavior. Sports are a healthy activity. We know that we have a problem with obesity and we have inactive kids, and kids should be playing sports, and it's a healthy thing. The other issue is competition or team sports. It's a camaraderie thing. They're going to learn how to be teammates. They're going to experience competition, and it's not winning and losing are not important at the younger ages. It does become more important later on, supposedly. Whether it should be or not is another issue, but it does. Again, when implemented well and properly by adults, it leads to increased psychosocial and confidence. They develop hand-eye coordination. I think that's really important. Actually, hand-eye coordination should be developed at an early time because if it is developed early on when it's supposed to be, adolescents don't struggle with this later on. The skills should not be taught until developmentally ready, and we'll talk about that in a minute, because you don't want to take a 4-year-old and try to have them hit a golf ball if they're not ready for it. This leads to frustration, and actually a lot of the children quit at that point because they don't feel they can master the skill. So it's important to have the timing right for children. Basically, athletics at this age is to have fun, F-U-N, fun. Acquire new skills while you're doing it, and master those skills so that they can improve their self-image. During that time, they have an approval of adults and coaches. They get peer approval. They want to get better, but they're basically attracted to activities that are enjoyed, and that's going to be the big thing. So why do we encourage our kids to participate in sports? Well, because the benefits far outweigh the risks to overall health. Most importantly, it develops the things we talked about, is ideal weight, coordination, an interest in lifelong activities, and fitness. And that is truly important in the age of obese children that we have. So what do you got in burnout in young athletes? I think when that athlete has very high self or external expectations, such as parental expectations, or that they put a lot of pressure on themselves to perform. Win at all costs attitude, parental pressure is big. Long practices with little variety. You can read the inconsistent coaching practices, the overuse injuries, which you'll start seeing, especially in a year-round swimmer, with I'm sure Dr. Kim will talk about shoulder impingement syndrome in young swimmers. The time demands. It puts a tremendous amount of time demands. It may take away from school. But on the other hand, kids that get involved year-round are very disciplined and usually find that they manage time very well, and that's actually kind of good if you've got a young child that really is able to manage his time. In 1997, there was a study that studied 29 sports under age 15, and there was $49 billion spent in 1997 on sports injuries in that age group.
By age 13, 70% of the kids drop out of athletics, and mostly because of us, adults, coaches, and parents, and they simply lose the desire to participate. And we want to prevent that because Dr. Parker has already discussed all the positive things that could come out of getting involved in athletics, and we want to keep that going. 20% of children between age 8 and 12, and 25% children between 13 and 14 will have arm pain during a single season, youth baseball season. So those are pretty big numbers. So, and you need to start thinking, why does it happen? And because of numerous things that Dr. Parker has already mentioned, because they do single sport, they get subspecialized too early, they do all year-round sports, single sport, multiple teams, and statistics like this start coming up. And over the past 10 years, there's been 5-fold increase in elbow and shoulder injuries in baseball and softball players. Let's quickly talk about the management. So how do we deal with these overuse injuries? So we got to figure out, is there anatomical cause? If there is, then we correct it with braces, inserts, taping, and then we got to control the inflammation, the pain-causing problem, taking anti-inflammatory medications like Motrin, Advil, and applying ice as needed. Promoting healing. We're talking about doing physical therapy, some rehab, or working with athletic trainers at that school who knows what they're doing. And promote healing. Once that's done, your body's normal. That doesn't mean you're ready to go back to playing athletic events yet, because you need to do fitness exercise. Your body has just gone from bad condition to normal condition. It's not quite in a competing condition yet. So you take something normal and get it to the competitive level. That is fitness exercise. So you want to do sport-specific exercises to get you back into jumping motion if you're a volleyball player, throwing motion if you're in baseball. And then control the abuse. You got to think about what got you in trouble in the first place. If you don't know that, you're going to come right back down here. It's a matter of time. We need to break the cycle of what got you into trouble and avoid it. And then you gradually return to sports participation. And this is the general management recommendations. And this will work for any overuse injuries.